Hello. Today I'm going to walk you through the proper administration of CLEVIPREX, clevidipine, including dosing, titration, and the transitioning of patients off therapy. Before we begin, let's briefly review the indication and contraindications for CLEVIPREX. CLEVIPREX is a dihydropyridine calcium channel blocker indicated for the reduction of blood pressure when oral therapy is not feasible or not desirable. CLEVIPREX is contraindicated in patients with allergies to soybeans, soy products, eggs, or egg products. Defective lipid metabolism seen in conditions such as pathologic hyperlipemia, lipoid nephrosis, or acute pancreatitis if it is accompanied by hyperlipidemia, and severe aortic stenosis. Complete important safety information for CLEVIPREX will be presented at the end of this video. CLEVIPREX is available in sterile, single-use 50 milliliter or 100 milliliter vials. You do not need to mix or reconstitute the contents since each vial is ready to use. Consider how long you may need to dose CLEVIPREX when choosing between vial sizes. Most patients achieve a desired therapeutic response at 4 to 6 milligrams per hour, or 8 to 12 milliliters per hour. Based on this dosing, a 50 milliliter vial will last for about 4 to 6 hours, while a 100 milliliter vial can last twice as long, about 8 to 12 hours. While handling CLEVIPREX, always practice aseptic technique. Also make sure that you thoroughly inspect the vial and package for any defects or contaminants before administration. This includes checking for things such as particulate matter or discoloration. Do not use the vial if you suspect any type of contamination. Once the stopper at the top of the vial is punctured, the contents must be used within 12 hours, and you should discard any unused medication. Before using CLEVIPREX, gently invert the vial several times to ensure the emulsion is uniform. If the vial and contents pass your visual inspection, you can start preparing the infusion of CLEVIPREX. Make sure that you always use a device that allows calibrated infusion rates. Individualize the dosage based on the blood pressure you are trying to achieve, as well as your patient's response to CLEVIPREX. Administer the CLEVIPREX infusion through a dedicated central or peripheral line. Commercially available plastic cannula may be used to administer the infusion. CLEVIPREX should not be diluted, though it is Y-site compatible with the IV fluids shown here. Do not administer CLEVIPREX in the same line as other medications. When you're ready to begin the infusion, start with a dose of 1 to 2 milligrams per hour. To achieve the desired blood pressure reduction, you will need to titrate CLEVIPREX. You may initially titrate by doubling the dose at short 90-second intervals. As your patient's blood pressure approaches goal, increase the dose by less than doubling and lengthen the time between dose adjustments to about 5 to 10 minutes. Typically, an increase of about 1 to 2 milligrams per hour will lead to an additional 2 to 4 millimeters of mercury decrease in systolic pressure. CLEVIPREX has an onset of 2 minutes and an offset within 5 to 15 minutes. Due to this rapid onset and offset, it is important that you continually monitor blood pressure and heart rate during the infusion. Take blood pressure measurements using a cuff or arterial line, especially while changing the IV set or vial. Be sure to continue monitoring until vital signs are stable. It's also important to check for any barriers or dead space in the IV line. If you are not seeing a response in your patient's blood pressure, this could be the reason. Most patients achieve the desired response at a maintenance dose around 4 to 6 milligrams per hour. The maximum dose given to most patients is 16 milligrams per hour or less. Patients with severe hypertension may require doses up to 32 milligrams per hour, but there is limited experience at this dose rate. After treatment with CLEVIPREX, you may consider transitioning your patient to an oral medication. If you do start oral therapy, it's important to take into account the lag time of onset of the new agent. Discontinue CLEVIPREX or titrate downward as the oral therapy takes effect. Also be sure that you continue to monitor blood pressure until the desired response is achieved. If you do not start oral therapy, blood pressure will fully recover in most patients within 5 to 15 minutes of stopping CLEVIPREX. Patients who receive prolonged CLEVIPREX infusions and are not transitioned to other antihypertensive medications should be monitored for the possibility of rebound hypertension for at least 8 hours after the infusion is stopped. These patients may need follow-up adjustments in blood pressure control. CLEVIPREX contains approximately 0.2 grams or 2.0 kilocalories of lipid per milliliter. As a result, lipid intake restrictions may be necessary in patients with significant disorders of lipid metabolism to compensate for the amount of lipid infused as part of the CLEVIPREX formulation. No more than 1,000 milliliters, or an average of 21 milligrams per hour, of CLEVIPREX infusion is recommended per 24-hour period. More information is available at cleviprex.com and in the full prescribing information. Thank you for watching. Please stay tuned for the full important safety information. Important safety information. CLEVIPREX, clevidipine, injectable emulsion, is contraindicated in patients with allergies to soybeans, soy products, eggs, or egg products. Defective lipid metabolism seen in conditions such as pathologic hyperlipemia, lipoid nephrosis, or acute pancreatitis if it is accompanied by hyperlipidemia, and severe aortic stenosis. CLEVIPREX is intended for intravenous use. Use aseptic technique and discard any unused product within 12 hours of stopper puncture. Hypotension and reflex tachycardia are potential consequences of rapid upward titration of CLEVIPREX. If either occurs, decrease the dose of CLEVIPREX. There is limited experience with short-duration therapy with beta blockers as a treatment for CLEVIPREX-induced tachycardia. Beta blocker use for this purpose is not recommended. CLEVIPREX contains approximately 0.2 grams of lipid per milliliter, 2.0 kilocalories. Lipid intake restrictions may be necessary for patients with significant disorders of lipid metabolism. Dihydropyridine calcium channel blockers can produce negative inotropic effects and exacerbate heart failure. Monitor heart failure patients carefully. CLEVIPREX is not a beta blocker, does not reduce heart rate, and gives no protection against the effects of abrupt beta blocker withdrawal. Beta blockers should be withdrawn only after a gradual reduction in dose. Patients who receive prolonged CLEVIPREX infusions and are not transitioned to other antihypertensive therapies should be monitored for the possibility of rebound hypertension for at least 8 hours after the infusion is stopped. There is no information to guide use of CLEVIPREX in treating hypertension associated with pheochromocytoma. Most common adverse reactions for CLEVIPREX, greater than 2%, are headache, nausea, and vomiting. Please see full prescribing information for CLEVIPREX at cleviprex.com.